Speak. Thank you. And then after Carmen Charles, we'll have Nola come up and speak.
I'm not in nobody's way, right? Good afternoon, Bronx. All right, we can do better than that. Good afternoon, Lincoln Hospital. I am no stranger to Lincoln Hospital or to HHC. As Mr. Roca said, my name is Carmen Charles. I am the proud president of Local 420. I represent the majority of healthcare workers in the health and hospital healthcare system. And I want to thank my friends and my brothers in arms of the United States Senate, the Senate leader, our fearless leader, Brother Chuck Schumer. And my friend, I'm proud to call him my friend, the Congressman Ritchie Torres, for standing with our members to correct the injustice.
Okay, thank you, Mr. Coker. And I first want to thank everyone who is here. My partner in getting FEMA to release these dollars, your great congressman, a man who's done so much in the past, is great in the present, and has even a greater future, Congressman Ritchie Torres. Now I have a trivia question about Ritchie. Is his real name Ricardo? Oh. He was named after a rock and roll star. Who knows? Ritchie Valens. And I will sing one line. When Ritchie Valens passed away in a plane crash, he had just written a song to his girlfriend, Donna. And she...
from H+H for COVID-related emergency expenses. This is an injustice that FEMA must correct. H+H is already an already underfunded system. Local 420 members and other healthcare professionals are working at facilities that are crumbling and chronically understaffed. We know to do more with less. We have become accustomed to doing more with less. We do it because we care about the patients that we serve. We don't do it because we are paid large amount of salary.
We also have from our Doctors Council, Dr. Akan Turkman from the doctors, also part of SEIU. Is Devin Gilliams here too? Devin Gilliams as well. Devin, stand up and take a bow. We also have from 1199, because a lot of unions represent the great workers here, Stacy Gray. Where are you, Stacy? Right here. We brought them up on stage in those great purple shirts. I love them. And Warren English. And then we have 5 members of the great New York State Nurses Association. I don't have their names, but raise your hands, nurses from NISNA. 860 million. Let's hear it. 860 million. 860 million. 860 million. All right. Guess who is leading the fight with me on that? Who has led the charge? He got every member of the New York delegation to sign a letter. The great Ritchie Torres. Not yet. Down. I am not finished yet, Ritchie. I might want to sing a few more bars. H+H system. They fought day and night to save lives of New Yorkers. And these were the early days. We didn't even know what was COVID. When someone came in with some symptoms, we weren't sure what it was at all. There was no testing. There was no PPE. And there were more questions than answers about how the virus spread. And yet, the workers here at the hospital came in, risked their lives, and some didn't survive, to help New York. Those were very difficult days. And our 11 public hospitals expanded to full capacity. When someone came in, you didn't know if they had COVID or not. So everyone had to be treated as a COVID patient. Beds that were normally not used for pandemic worked at Coney Island Hospital. But guess what she was a member of, Anthony? CWA, 1108, Cheliotis. Remember him?
You are the essential workers who put your lives at risk during the peak of the pandemic so that the rest of us could safely shelter in place. We stand on your shoulders. We are judged by how we treat the most essential among us, and you are the most essential among us. I want to thank the leadership, Dr. Katz, Dr. Roker. You know, Health and Hospitals has a special place in my heart. I'm a product of Health and Hospitals. I was born in a public hospital. And as a child, I had battles with asthma, but no matter how many asthma attacks I would have, no matter how often I would have to go to the hospital, I always had the peace of mind that I had somewhere to go, and that was Health and Hospitals. And you are certainly the great equalizer in our city.
Health problems in all of New York State? Lincoln. Yes, this hospital plays a very special role in achieving social justice. And I love looking out at all of my doctors and nurses and support staff and knowing how hard you all work to take care of our patients. We went through hell, did we not? Was it not hell? Do you remember those nights when we were figuring out where the new 16 intubated patients would go? Yes. Right. Were we thinking, oh, go to the special FEMA ward we built? No. We just said everybody's going to be taken care of. And we did. And never once did we think, oh, well, I wonder if we can afford that. No, we said people's lives were at risk. This is a declared emergency. We can depend on FEMA.
But we did it, and we deserve to be reimbursed for all that we have done. Thank you very much.
Good job.
Thank you.
Dr. Campbell and then Dr.
Hi, good afternoon, everybody. I'm Dr. Turkman from Doctors Council. I'm so proud to be here and to be part of the H&H team. I've been working at Coney for over 20 years, and I can say that Coney and all of H&H are not just safety net hospitals, but some of the best hospitals, not just in the state or city, but in the country. We provide excellent care, and on top of that, we provide care to everyone, regardless of where they are, what they came from, what language they spoke. And everybody at H&H stepped up. My fellow doctors, the nurses, the staff, everybody stepped up, worked tour after tour during this COVID pandemic.